Welcome to your guide to facelift surgery. Take a few minutes to familiarize yourself with the procedure and what you can do to help improve your results. Remember, this presentation does not take the place of your consultation, and you should make sure to jot down any questions you may want to ask us later. A facelift or rhytidectomy is one of the most common facial procedures to help return a more youthful look to the face. Performed on more than 110,000 men and women a year, a facelift addresses the concerns of the lower two-thirds of your face. It removes lax facial skin, repositions and reduces underlying excess fat deposits, and tightens underlying muscles and deeper tissues, giving you a more rested, youthful look. Today's facelift is more effective, natural-looking, and longer-lasting than ever before. Many patients can look as much as 10 to 15 years younger. It is often performed in conjunction with other procedures such as a neck lift, eyelid surgery, brow lift, dermal fillers, fat grafting, and skin treatments. Procedure. How will your facelift be performed? There are a number of different options to help tailor your procedure to your specific needs. During the traditional facelift, the incisions usually start above the hairline, extend down in front of the ear, and circle back within the hairline. After the skin is released and raised from the face, a layer of tissue called the SMOS, superficial musculoaponeurotic system, is exposed. This layer is repositioned and or tightened, excess skin removed, and the incisions are closed with very fine sutures. The short scar S-lift is a type of mini facelift that utilizes a small S-shaped incision in front of the ears to work on the middle third of the face. It is designed to correct limited changes in the cheek and jawline areas. The Max lift is a variation on the S-lift and utilizes a permanent purse string muscle suture technique. A neck lift is commonly performed in conjunction with a facelift to eliminate hanging neck skin, muscular bands, and excess fat that mask smooth defined neck and jaw contours. If only the neck lift is performed, incisions are confined to behind the ears or under the surface of the chin. Liposuction may be used as well to remove fat and tighten the skin. Together we will select the technique that will provide the best result for you. When you meet with our patient coordinator, we will discuss fees and costs. Preparation. Every person has a unique perspective on age and beauty, and your goals will affect the way your facelift is performed. It is important to discuss your desires and listen closely during the consultation so that you can set realistic expectations. A great result can only be achieved when there is good communication between us. You also need to understand that the shape of your face before surgery will partially determine the shape you have after surgery. Some suggestions to help you prepare for surgery. Your safety matters to us. You should be very open. Provide your medical history, drug allergies, list any previous surgeries, medications, diet pills, vitamins, and herbs you are taking, even if you don't think they're important. Also, don't be afraid to be frank with us about your lifestyle, smoking, the strenuousness of the work you perform, your exercise habits, and the importance of getting back to work. Here are some tips that may help you reduce scarring, shorten your recovery time, and decrease your chances of complications. Discontinue using aspirin, ibuprofen, naproxen, St. John's wort, and vitamin E for 1 week before and a few days after your procedure. These act as blood thinners and could cause problems with blood clotting. Stop smoking and drinking alcohol in excess well in advance of your facelift and for 1 week after surgery. Drink lots of water in the days leading up to your facelift. Hydration will help you recover more quickly. To make your recovery easier and more comfortable, be sure to arrange for someone to take you home and take care of you for at least the first 24 hours. Fill your prescriptions prior to surgery and place them within easy reach of where you will be resting. Place plenty of pillows or a bed wedge nearby so that you can keep your head elevated at all times. You may also want to allow your hair to grow out if it is short. This will help hide scars after surgery. Recovery. You should expect some bruising, swelling, and the feeling of tightness. While your face is swollen, it will probably look and feel strange to you. Stitches will come out or be absorbed on their own between a week and 10 days. Bruising and swelling will subside significantly within a week to 10 days. If you feel like you've lost sensation in the treated areas, don't be alarmed. As your nerves begin to regenerate, feeling and sensation should return to normal. Pain is moderate with this procedure, but a pain medication will be prescribed to control any discomfort. However, if you begin to have a sudden onset of pain, or if your pain becomes severe, contact us immediately. The recovery process is different for everyone, but within a day of your facelift, you should be up and walking around. Keep your head elevated at all times for 2 weeks following surgery. You may also apply small ice packs to help reduce swelling and discomfort. Over the next couple of weeks, your face may be very sensitive, and you may want to consider using special camouflage makeup as you heal. For the first week or two, you should plan on being out of work and away from your usual activities. After this period, you may gradually return to activities such as lifting, exercise, and sex. Avoid any high-impact activities for about 1 month. Stay away from saunas for a few months, as the steam can affect healing. These precautions will help you avoid stress to your scars and allow time for your facial tissues to heal and recover. While there will be permanent scars, in most cases they will be well hidden. The scars are usually small and become difficult to see as they heal over time. Your facial appearance should improve over a period of several months. What are the risks of facelift surgery? This information is not intended to frighten you, but to help you make an informed decision. No question or concern is silly or insignificant. We will be happy to discuss the full range of potential complications and answer any questions you might have regarding this procedure. Thankfully, complications are infrequent in facelift surgeries, and many thousands of procedures are successfully performed each year, but they can occur. Complications can include, and are not limited to, hematoma, infection, reaction to anesthesia, nerve damage, and damage to underlying facial structures. As with all medical procedures, be sure to choose your surgeon wisely. It is important to choose an experienced surgeon you can trust and develop a good rapport with, so you can openly discuss your concerns and particular needs throughout the process of consultation, surgery, and aftercare. Should you decide to move forward with your facelift, a surgery date will be scheduled. Prior to your surgery, you will be given complete preparation and recovery instructions. Remember to keep your follow-up visits, as we are here to help make this a wonderful experience for you. Feel free to review any part of this presentation you like, and be sure to take a look at our before and after gallery to get a better idea of the results you may achieve.